Greetings. It's a tremendous pleasure to be able to talk to you today. My name is Iracema Leroi. I'm an Associate Professor of Geriatric Psychiatry at the Global Brain Health Institute at Trinity College Dublin in Ireland. And today I'll be saying a few words about the global impact of dementia and the importance of international collaborations. I'll just share my slides with you now. So this is my university in Dublin, Trinity College. It's an old university that was started in 1592. And I do hope that you'll all come and visit someday in Ireland and let me know when you come. We have one of the most beautiful libraries in the world, as you can see here. This is an ancient library, and you're very welcome to visit. But we've also got some lovely green spaces in Ireland. So talking about dementia, many have referred to this idea of a burning platform. In other words, this is a very urgent issue. Now, this language is a little bit catastrophic, but at the same time, it's very important to recognize that the world is aging, and age is one of the most important risk factors for dementia. Nearly 50 million people live with dementia worldwide, and this is due to increase to over 130 million by 2050. So what exactly is dementia? Now, you've been hearing a lot about this, but I'll just touch on it briefly. First of all, dementia is not a disease. It's a clinical syndrome due to multiple diseases of the brain, the most common of which is Alzheimer's disease. It's a condition that's chronic and progressive in nature, so it doesn't get better, it simply gets worse over time. It involves the disturbance of multiple higher cortical functions, in other words, abnormalities of thinking, memory, attention, language, visual spatial function. And it leads to difficulties in managing one's day-to-day life. Consciousness is not impaired, so it's not like delirium, and is often associated with a deterioration in emotional control, social behavior, or motivation, leading to what we call behavioral and psychological symptoms of dementia. Dementia is one of the main causes of disability later in life. And this is ahead of cancer, cardiovascular disease, and stroke. And yet in many places in the world, it is one of the least recognized causes of disability. And this needs to change. In the UK, there are currently around 900,000 people with dementia. And the UK has a population of about 65 million people. 1 in 6 people over the age of 80 have dementia. So if you live long enough, your chances of developing dementia are significant. But it's important to remember that there are also people in their 50s, or sometimes in the late 40s, who develop dementia. In other words, young onset dementia. And in many countries, particularly lower and middle income countries, the incidence of dementia starts and increases in people already in their 60s. The worldwide costs are significant. And as you can see here from the first pie chart, that those in high income countries in the gray provide a significant greater cost due to dementia compared to low income countries and lower middle income countries, mostly because in those countries, dementia is under-recognized and it's not considered as part of the health and social care ecosystem. However, if dementia was a country, it would rank 18th in the world in terms of GDP, gross domestic product. So this is significant. So what about the prevalence? In contrast to the costs, the prevalence is the reverse. And in fact, nearly 2/3 of the world's 50 million people with dementia live in lower and middle income countries like Bangladesh. And this is a challenge because it's particularly the place where stigma is often very high and people do not recognize dementia or it is not treated in the right way. And there's often a lack of understanding of dementia as being outside of the normal aging process. So there is an urgent need to recognize and support families affected by dementia, because some even say that in lower and middle income countries, dementia is actually becoming a new epidemic. And currently in Asia, there are about 20 million people affected, and more than 90% of them will never get a diagnosis. And a diagnosis is important because only through a diagnosis can you get support and care, not only for the person with dementia, but also their families. And importantly, it comes with a huge emotional and economic burden, particularly in women, partly because women are the most commonly affected, and also because they're often the care partners. And because of the importance of the impact on care partners, I'm going to spend the next couple of slides just touching on that idea of the impact on dementia on families and caregivers. Eleanor Roosevelt, a few years ago, said that there are only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers. So it's incredibly important that we focus on this group of people and how dementia impacts on them. The impact of care provision is that it can be physically demanding and mentally exhausting. It can lead to negative feelings, stress, and burden. It is associated with decreased quality of life on the part of the care partner, worsening physical and mental health, and very often, not only is the person with dementia a patient, but their care partner can become a patient, but they're hidden patients. In other words, often their needs are not recognized. Loneliness and social isolation in care partners is significant, and we've seen this particularly during lockdown, during the COVID-19 pandemic. We surveyed over 5,400 care partners of people with long-term conditions around the world, and we found significantly high loneliness and social isolation indices in people who were care partners of those with dementia. So it's very important to recognize and support. However, these sound like doom and gloom messages, and I think it's important that we consider moving away from the so-called disaster narrative and consider the language that we use as we move forward to tackle this challenge. So, for example, instead of referring to a person with dementia, rather we should refer to a person living with dementia, rather than saying you're a patient or a demented person. A person with dementia is only a patient when they're sitting in a clinic or in a hospital setting. Otherwise, they're a person who lives with dementia, and they get on with their life, and they interact with their family, and they can enjoy themselves, have meals, go out, and have a good quality of life, given the right circumstances. We also refer to living with dementia rather than suffering with dementia. And I think looking at this in a positive way to see how we can best improve people's lives is important. And also, I think it's important that we move away from this idea of a broken or damaged brain and instead start focusing on brain health. And that's the next part of my talk, is thinking about brain health, what that means and what we can do. So, just to take you back a little bit on the historical journey of dementia in Europe. About 10 or 15 years ago, we hardly mentioned the word. It was called the unmentionable D word. We were afraid to say that somebody had dementia, afraid to discuss it with families. Instead, we talked about getting old or being a bit forgetful or having a little bit of memory problems. But we've moved beyond that in the West, although still in South Asia, very often it's unmentionable still, and there's a lot of stigma and lack of understanding. But now in the West, we are moving into what we call a dementia-friendly society. So we are quick to diagnose people because we think that it leads to support and care, and society fosters quality of life in people with dementia, recognizing that they will live with this condition for many years. And again, given the right circumstances, can live a full and successful life. But to achieve this, we have to also become a healthy brain society. And through being a healthy brain society, we can one day perhaps become a dementia-free society. Now, how will that happen? A dementia-free society can happen because if we find an intervention that can delay the onset of dementia, that may not be able to cure it, but it can delay the onset for 5 years, that will result in at least a 40% lower prevalence and a 40% lower cost by 2050. And that's important. But what intervention might this be? Yes, we can look for a magic drug, but that will only be appropriate for a very small number of people in the very early stages and will come with a big cost. However, we can perhaps think of an intervention such as prevention, and again, thinking about brain health, because that is the key to dementia prevention. So let's think about this new focus on brain health. What do we actually mean when we talk about brain health? Well, brain health is a state in which every individual in society can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with life situations, even if you have a brain disorder, such as dementia, such as epilepsy, such as stroke, or brain trauma. And this very much feeds into this idea of how we can optimize brain health. And when it comes to dementia, the dementia prevention story is very important. So I'll draw your attention to a landmark report that first came out in 2017 and was updated in 2020. This is the report led by Jill Livingston from the Lancet Commission about dementia, prevention, intervention, and care. And the important finding from this report was that 40% of dementia may be due to 12 risk factors. And if we address these 12 risk factors, in other words, risks to brain health, we may go a long way in moving towards a dementia-free society. So what are these risks to brain health? Well, first of all, it's about having education over the age of 12. Secondly, it's about midlife, hypertension, obesity, and diabetes, alcohol use, traumatic brain injury, late life depression, physical inactivity, smoking, air quality, social isolation, and midlife hearing loss, which accounts for 8% of this model of 40%. So all of these factors are potentially modifiable at a societal and community level, so we need to take heed. And how do all of these factors play out in South Asian societies? Well, the brain health challenges in South Asia are significant because if we think of many of these risks, they're high. What about head trauma? The number of people who travel without proper head protection on motorbikes and bicycles in heavy traffic is significant. Head trauma is a significant challenge in South Asia, particularly in the busy cities. What about the risk factors of hypertension, obesity, and diabetes? There are many dietary issues which need to be considered, including food with high cholesterol. Air pollution. Air pollution is a major risk factor for poor brain health and subsequent dementia. And this is a picture I took myself the last time I was in Dhaka. And air pollution was very high. Most people were wearing masks. But here you can see this man here on the bicycle rickshaw. He wasn't wearing a mask, and all day long, he's got high cardiovascular output, breathing in the poor air. Therefore, his brain risks are significant. Then what about loneliness and depression in older people? And loneliness and depression in older people can even occur in the context of a multi-generational family, where an older person may be surrounded by people all day long. However, if their needs aren't addressed, if they're not talking to people of their same age, meeting their peers, they can still be isolated and alone. And also, a very important one, hearing impairment, which has significant implications in South Asia because there's some evidence to suggest that age-related hearing loss starts 10 years before age-related hearing loss in the West. And there's a number of reasons for that, partly to do with high volumes of traffic and noise, partly to do with air quality, which affects hearing, and also to do with cardiovascular risk factors such as diabetes, all of which impact on hearing. And the challenge is because at this stage in Bangladesh, there is a huge gap in the provision of care for brain health disorders. As you can see here, although in spite of the estimated dementia prevalence in the region, there are hardly any neurologists, barely any psychogeriatricians, long-term care facilities are only just starting to develop, adult daycare centers are nearly non-existent. So there's a huge challenge to address in order to look at how best people's needs can be met. And this is important because the Global Action Plan and Public Health Response to Dementia that came out for 2017 to 2025 lists all these factors that need to be considered. Namely, that countries need to put dementia as a public health priority. Dementia awareness and friendliness is significantly important. We need to think about the risk reduction, all those factors that I've just mentioned. We need to improve the capacity for diagnosis, treatment, and care, support for dementia carers so that they don't become the hidden patient, information systems for carers, and of course, dementia research and innovation. And that's really where the potential for collaboration and international partnerships comes in. And I'll just draw your attention to the World Alzheimer Report from 2021, which was recently launched. And you can see this online, and I think it's extremely helpful. But some of the key findings from the survey they undertook was that the barriers identified by people with dementia and carers to getting the right care was lack of access to trained clinicians, fear of diagnosis, and also cost. The key barriers to diagnosis identified by clinicians included lack of access to specialized diagnostic tests, lack of knowledge in making a diagnosis, and believing that nothing could be done. So these factors can be addressed through education. And that brings me to talking about the International Dementia Academy Bangladesh that we launched last year and successfully ran over the course of 6 months with our first delegate group of 25 clinicians from Bangladesh. And our aim in running this course was to improve the awareness and understanding of dementia amongst healthcare professionals through a Bangladesh-Ireland collaboration to address these issues that I've been talking about. So these are the partners that we included in our International Dementia Academy. As you can see, there are a number of local as well as international partners, including the Global Brain Health Institute and Trinity College Dublin. And with this partnership, as you can see, with these multiple partners, was led by a team of people, again, from Bangladesh, Sweden, and Ireland, to be able to deliver this training. And I'm going to leave it there. And I just want to thank you very much